As a plastic surgeon practicing in Manhattan, my patient population who seeks breast augmentation are not women who are movie stars or women who are looking to be models for very skimpy swimsuits, but they are mothers who've had a few children and want to restore the volume and shape they had before they gave birth, or they're young girls who unfortunately Mother Nature didn't give them the average volume they were looking for so they could look better in their bathing suits on the beach or in their dress they're wearing to some a family event. And I think the key to breast augmentation for any of the patients is that you want to restore a natural look so no one really knows that she has implants. That's the last thing you want. When you evaluate the patient, you have to look at the patient from several components. You have to look upon, do they have an excess of skin? Is their skin droopy? How wide is their chest? Are they narrow chested? Are they broad chested? Do they need more volume or do they need volume and projection? One of the advantages of the current generation of silicone implants, and although I use saline and silicone, I believe the silicone implant gives the patient a more natural feel, a more natural looking result, is that I can select and pick the custom implant for the patient. Not custom in the sense that it's made exclusively for them, but from the whole shelf of types of different styles and shapes, we can pick the right implant for the patient, so we can customize the procedure for the patient. There are several questions the patient has to ask, or you as a patient have to ask me when we pick the implant. Where am I going to make your incision? Am I going to make it under your breast, around your nipple, or in the axilla or the armpit area? 95% of the patients have their incisions made under the breast. The second question is the pocket going to be made below my breast and above my muscle or under the muscle itself? Again, most patients these days have a submuscular pocket, which means it's made under the pectoralis muscle. And then the final question is, which implant is it? What is the size of the implant? And what is the shape of the implant? And what is the style of the implant? And any plastic surgeon who says they use one style or one shape is not doing you a service, because the truth is that means they're not looking at the patient and deciding for that patient what is the best shape implant, what is the base size implant as far as the base, what is the best style implant for you to correct the exact configuration of your body.